perform a written demonstration about the assessment of the eyes. So first is we need to gather all the equipment needed. So we need a Snellen chart for us to quickly assess the monocular and binocular visual acuity of our patient, also the handheld Snellen chart, a pen light, an opaque card used to check the alignment of the eyes, and also the ophthalmoscope. It is a device used to examine the interior structure of the eyes. Next is we're going to explain the procedure to our patient. So, hi ma'am, good morning. I am Daya Malayan, your student nurse for today. May I have your name, please?
Dear Malayan.
Your birthday?
November 1997.
Your age po, ma'am?
25.
Okay po. So for today, ma'am, we're going to have an assessment to your eyes for us to know if you have any problem in your eyes or in your vision, and also for us to detect if you have any eye conditions such as cataracts, glaucoma, and any other conditions that can result to sight loss. So, for us to provide medication and proper preventive measures to prevent a risk. Ma'am, before we proceed to the procedure, I just have some questions for you to answer po. Is that okay po? So, ma'am, have you had any difficulty seeing or experiencing blurred vision po? So that's why you're wearing glasses. Alright. Have you had any red experiencing of redness, swelling, or watering or discharge from your eyes po? Okay po. Have you ever diagnosed with any eye conditions po? Alright. Are you currently using any medication to your eyes like vitamins or eye drops? Okay po, thank you. So, now, before we proceed to the procedure, is we need to have a proper hand hygiene for us to prevent infection, and also we need to close the door or the window if there's any open doors or window for us to provide privacy or confidentiality to our patient and also to their information. So, and after that is we're going to proceed to the procedure. First is we're going to perform a vision test for us to know the capacity of our patient to discern or to resolve any the details of an object. So the first thing we need to do is we need to perform the distant visual test. So in this test is we're going to see the ability of our patient, their ability to see or to discern letters or numbers at a given distance or a certain distance. So, in this procedure is we need a Snellen chart for us, and also we need to place the patient 20 feet or 6.1 meters away from the Snellen chart. The position of our patient can be sitting position or standing position as long as the Snellen chart is an eye level of our patient. So I'm going to place my patient 20 feet away from the Snellen chart. Alright. So I already put my Snellen chart there in the wall, and then I already placed my patient 20 feet away from the Snellen chart. So, and in this test is we need an opaque card to cover the one eye of the patient, and they were going to read the Snellen chart there. Instruct the patient to cover her one eye with a opaque card and read the Snellen chart.
E F P T O Z L P E D P E P E C F D.
So the patient can only read until here in the 20/40 vision in the left eye. So
E F P T O Z L P E F P T O Z.
So the patient can only read here in TOZ in 20/70 in her right eye. So now we're done testing the distant visual acuity of our patient. We're going to proceed to the near visual acuity of our patient. We need a handheld Snellen chart for the patient to discern the letters on it. So the patient will hold 14 inches away from the will hold the Snellen chart and put the Snellen chart 14 inches away. So we're done doing the near visual test of our patient. So next is we're going to perform the visual fields test. So alright. So next is cover test, and we're noting any drifting here. We're going to uncover the one eye of the patient, and the gaze should be steady, and when the eye is covered and uncovered, it should be no drifting. So now I'm going to have you follow this pen with your eyes while your head will just keep still, and then I'm going to have this pen move to 6 cardinal position of gaze, so just follow it with your eye. So what we assess here is to determine the alignment and coordination of the eyes. It should be both eyes coordinated and move in unison with parallel alignment. So now I'm going to inspect the eyelids and eyelashes of our patient. So what we're going to note here is the comparison with both eyeballs, the color, swelling, or any lesions or discharge. We also need to note if there are any presence of edema in our patient, and also palpebral fissures should be symmetrical. We also need to inspect the palpebral and the bulbar conjunctiva of our patient for us to note if there are any presence of lesions, the color, the textures of our mucous membrane. It should be transparent and capillaries sometimes evident. So next is we need to palpate our nasolacrimal duct for us to note if there are any drainage from the puncta. So next is we need to inspect the corneal lens of our patient to note clarity and abrasions, and also we need to inspect the iris and pupil for us to know if the shape and the color, the size of our patient's pupil. So next is we need to darken the room to test the pupillary reaction to light of our patient. So we need to instruct the patient to focus on a distant object and then shine a light obliquely into the pupil and observe the pupil's reaction to light. It should be pupils should constrict. So next is we need to test the accommodation of pupils by shifting gaze from far to near. So the normal pupil constrict with a focus on a near object and the lights on a focus on a far object. So now we're going to proceed to the assessment of the ears. So first is but before we proceed to the procedure is we need to perform hand hygiene for us to prevent infection. And also close the window if there are any open window and doors, so to provide privacy and confidentiality of the patient and also to their information. So ma'am, we're going to proceed on inspecting your ears po. Is it okay with you po na I'm going to touch your ears? Okay po. So first, in assessing the ears of our patient is first we need to inspect the auricle, the tragus, and the lobule of our patient. So the ears of the patient. Also, what we're going to inspect here is the size, the color, and the symmetry of our patient. So as I can see that the ears of my patient are just symmetrical to her face. So it's just in the normal. And also there is no presence of lesions, the color, So, and next is we're going to, and also I'm going to insert the triangles to view for us to know if there are any discharge. So, as I can see that it is clean and it is dry. So next is we also need to palpate the auricle in the mastoid process of our patient to see if we're going to know that there are any tenderness. So tenderness of the ears of our patient, as I can see, it is non-tender. So next is we also need to inspect the internal structures of the ears of our patient by using the otoscope. But since we don't have that one, I'll just need to explain you guys how you gonna do it and what you're going to observe in examining the interior structures of the ear of our patient. What you're going to observe there to inspect there is the external auditory canal of the patient. We're going to, with the use of the otoscope, you're going to note if there are any discharge or if there are any consistency of the cerumen or also the color in the inside, and also the consistency of the canal walls, and if there are any presence of nodules. So you need to note that in examining the external auditory canal of our patient. So next is how the patient performed the Valsalva maneuver for us to know, to observe the center of the tympanic membrane and also tympanic membrane for a flutter. So, but this Valsalva maneuver do not do this in age 50 years above of a client. So next is we need to perform whisper test.
Apple.
So as you can see that my patient is unable to hear the whisper words that I say. So next is we need to perform the Weber test. So in this test is we need a tuning fork, but as of now we don't have any tuning fork. So I'll just explain you guys what you're gonna need to do in this test. So in this test is you're going to put the tuning fork here in the middle in the forehead of the client. So in the middle of the forehead, and also in the center. So and also you need to ask the patient if it is sound better in one ear or the same in the both ears. So next also is we need to perform a ringing test. In this test is we also need a tuning fork again, but since we don't have any tuning forks, so we just need to I'll just explain again what we're going to do in this test. So the tuning fork, we're going to place it at the base of the mastoid process of our patient, and also when the patient no longer hear the sounds, is you're going to note the interval. Then after that you're going to move the tuning fork to the external ears of our patient. Then also again, when the patient no longer hear the sound, you also need to note the interval again, the time interval again. Since we need to make the patient perform the Romberg test. So the client should be in standing position, and then it should be the client should be comfortable, and it should be in the correct postures, like the feet the feet with the feet together, and arms it can be and the arms it can be like here in cross of the heart, or in the chest, or in just swaying.
So in this test is we need to ask the patient to close their eyes for 20 seconds, and also as a nurse you need to stay by her side just in case if the patient will lose balance.
So after performing all the procedures is we need to
to formulate a nursing diagnosis of what you observe to your patient, and also we need also to promote collaborative problems, and also to make we need a referral to other healthcare workers to provide the needs of our patient.